Now, a nasal cannula is a device that we will use to ventilate a patient who is in need of low flow oxygen. They're breathing on their own. They have adequate chest rise and fall. They have good tidal volume. They just need a little bit of extra oxygen to help them through a rough spot. We will typically give this to almost all of our patient contacts. A little nasal cannula, a little oxygen helps a lot of people. You don't have to set it up exceedingly high. This can be set as low as, what's our lowest setting on this regulator? Quarter liter, half liter, 1 liter, 2 liter, 3 liter, 4 liter. Set it up very low, or we can even set it up as high as 6 liters. But please, guys, if you're using a nasal cannula, forcefully blowing air through those little ports up into the patient's nostrils, and you're setting it at 6 liters per minute, that's painful. It's very drying to the membranes inside the nose. Don't do that to your patient. If your patient needs that much oxygen, give them a non-rebreathing mask. Anyway, we're gonna say that this patient just needs very low flow oxygen to help them through a tough spot. She's gonna go ahead and put those prongs into the patient's nostrils. It's gonna loop down behind the patient's ears on either side. There you go. And then there's a little cinch right here. It's kind of hard to put it on a mannequin because they don't have actual ears. I'm gonna slide that cinch right up underneath the patient's chin. So now it's connected and attached to the patient. They are receiving oxygen via those prongs right on up into the nasal passageways. Now, again, we set this, the highest liter flow that is we can use this with, it'd be a 6 liters. But again, at 6 liters per minute, you need to consider adding a humidification device that we don't generally have in our 911 rigs, or you need to step them up to the next level, which would be a simple mask or a non-rebreathing mask. And we'll discuss those in another skill sheet. Okay? So that's your nasal cannula. Pull it out a minute, Aaron. I want to show them something else really quick. Your nasal cannulas are typically curved. You see the prongs have a little bit of a curve to them. When you go to put the prongs in, make sure they're curved like this going into the nose, okay? Don't put them in with the curve this way because then that oxygen is just gonna be blowing out the patient's nostrils. Insert it so that the curved prongs go down, up and down into the patient's nostrils, like that. Okay? Show them that really quick. There you go. And that's how we would do it, all right?